Health Insurance Portability and Accountability Act. Before we dive into the details of HIPAA, let's briefly look at how the law has evolved over time. This law was enacted in 1996 to improve the healthcare system and establish a framework for protecting health information. As healthcare became increasingly digital, additional rules were introduced. The Privacy Rule in 2000, the Security Rule in 2003, the Breach Notification Rule in 2009, and the Omnibus Rule in 2013, which strengthened HIPAA and expanded the responsibilities of business associates. HIPAA applies to three types of covered entities: health plans, healthcare clearinghouses, and healthcare providers, and one additional category called business associates. The first category is healthcare providers, such as physicians, hospitals, dentists, pharmacies, and clinics. A provider becomes a HIPAA-covered entity when it electronically conducts standard healthcare transactions, such as submitting insurance claims or verifying insurance eligibility. Once covered, HIPAA protects all protected health information, whether it is electronic, paper, or oral. The second category is health plans. These organizations provide health insurance coverage or pay for healthcare services. Examples include private health insurance companies, employer-sponsored health plans, Medicare, Medicaid, and HMOs. The third category is healthcare clearinghouses. Think of them as translators between healthcare providers and health plans. They help different computer systems communicate by converting electronic healthcare data into standardized formats, making the exchange of information faster and more efficient. Finally, business associates are organizations that provide services to covered entities and require access to protected health information. Examples include cloud service providers, medical billing companies, IT vendors, and outside law firms. Although they are not covered entities, business associates have direct compliance obligations under Health Insurance Portability and Accountability Act. Now that we've discussed who must comply with the Health Insurance Portability and Accountability Act, let's look at what information HIPAA actually protects. Under HIPAA, protected health information is individually identifiable health information created, received, maintained, or transmitted by a covered entity or business associate. To determine whether information is PHI, ask yourself two simple questions. First, can it identify a specific individual? Second, does it relate to that person's health, healthcare, or payment for healthcare? Information is considered protected health information only if the answer to both questions is yes. For example, a patient's name alone is not necessarily PHI, and a medical diagnosis without identifiers may not be PHI. However, if a patient's name is combined with a diagnosis, laboratory results, prescription information, or billing records, the information becomes PHI because it both identifies the individual and relates to that person's healthcare. Examples of identifiers include a patient's name, address, date of birth, social security number, medical record number, health insurance policy number, email address, and even a full-face photograph. In total, HIPAA defines 18 categories of identifiers that can be linked to a specific individual. It's also important to remember that information that has been properly de-identified under Health Insurance Portability and Accountability Act is no longer considered protected health information. Once all required identifiers have been removed and the information can no longer be used to identify an individual, HIPAA no longer applies to that information. When can protected information be disclosed? A common misconception is that HIPAA always requires a patient's written authorization before PHI can be shared. In reality, that's not the case. Under HIPAA, a covered entity may use or disclose PHI if the privacy rule permits it or if the patient has provided a valid written authorization. One of the most important exceptions is treatment, payment, and healthcare operations, commonly referred to as TPO. For treatment, PHI may be shared between healthcare providers to coordinate a patient's care. For payment, PHI may be disclosed to a health insurance company so that a claim can be processed and the provider can be reimbursed. For healthcare operations, organizations may use PHI for internal activities such as quality improvement, employee training, auditing, accreditation, and compliance. Health Insurance Portability and Accountability Act also permits certain other disclosures without authorization, including when required by law, for specified public health activities, or during government investigations. Although Health Insurance Portability and Accountability Act permits many disclosures without patient authorization, written authorization is required in certain situations. These include most marketing activities, the sale of PHI, and other uses or disclosures that are not otherwise permitted by the HIPAA privacy rule. To be valid, an authorization must meet specific HIPAA requirements, including describing the information to be disclosed, stating the purpose of the disclosure, and being signed by the individual.